Corporate Accountability and Public Participation Africa CAPPA has urged the federal and state government to urgently address Nigeria's broken food system as part of effort to curb the rising incidence of cancer in the country. The call was made in a statement issued on Tuesday to mark World Cancer Day 2026, themed United by Unique, where the organization expressed solidarity with millions of people affected by cancer globally while advocating for both patient centered care and stronger prevention focused policies in Nigeria. Kappa warned that cancer has become a growing public health crisis in the country, citing figures from the National Institute for Cancer Research and Treatment, which show that over 120,000 new cancer cases and no fewer than 72,000 cancer-related deaths annually. Beyond genetic and environmental factors, is increasing evidence linking cancers such as colorectal, breast, and prostate cancers to poor diets and harmful food production processes. According to CAPPA, contributors to the crisis include unrestricted marketing and consumption of ultra-processed foods, weak regulation of tobacco and emerging nicotine products, and excessive intake of sugar-sweetened beverages and starch, all of which are major risk factors for cancer and other non-communicable diseases. The organization called for stronger healthy food policies, including stricter regulation of tobacco and nicotine products, and increase the tobacco control budget, the introduction of mandatory salt reduction targets from processed foods, and a review of the sugar sweetened beverage tax from the current 10 naira per litre to 50% of the final retail price. CAPPA also advocated restrictions on marketing unhealthy foods to children and the adoption of clear nutrition standards for schools, hospitals, and other public institutions, emphasizing tobacco as one of the most preventable causes of cancer. CAPPA urged full implementation of the National Tobacco Control Act, inclusion of new and emerging nicotine products in advertising, bans, excise taxes adjusted for inflation, and stricter enforcement against illicit tobacco and nicotine trade. The organization further commended the federal government's plan to earmark pro-health taxes for cancer prevention and care, noting that such measures could reduce out-of-pocket healthcare spending, warning that Nigeria's health system remains overstretched with about 40,000 doctors serving over 200 million people. CAPPA stressed that Nigeria cannot rely solely on treatment to overcome the cancer crisis, adding that prevention-focused policies related to tobacco, food, and alcohol, combined with early detection, sustainable health, financing, and accountability could save thousands of lives each year.